The Affordable Care Act is 1,000 pages long. It was the subject of campaign, controversy, and genuine concern about personal health care. It's also legislation many Washington lawmakers said they didn't even read before passing.
The author of the new health care law just say he really didn't read the bill he wrote?
You know why? It's statutory language.
It is now law and affects a lot of people in this country. In the state of Missouri alone, about 857,000 residents do not have insurance. That's 15% of the population. 888,000 adults and children are enrolled in Medicaid. Starting this fall, they'll notice some changes, especially when it comes to preventing disease.
And we were able to look at the overuse of the emergency room and look at readmissions of the high utilizers that use both the emergency room and the hospital that overutilize the dollars in the system.
Ben Ernst is the CEO of Northwest Health Services, which has been pouring through the Affordable Health Care Act. His clients, who are on Medicare and Medicaid, stand to see a big difference.
Particularly around the poor and those on Medicaid, and be able to get them assigned, and the uninsured, and get them assigned to medical homes so that their care can be managed better. Part of that has been done through what we call our Community Access Network, a partnership with Heartland, ourselves, Northwest Health Services, and Social Welfare Board around patient-centered health homes.
How much Medicaid grows in the state because of the law has yet to be determined. Governor Jay Nixon has proposed to do so, but Republican lawmakers have expressed opposition to a Medicaid expansion. Under the law, state-run health insurance exchanges were also designed to offer competition to the marketplace. They're underway in over 5 states, but state-run exchanges in Missouri have been voided because of Senate Bill 464. It was introduced by Senator Rob Schaaf. The bill prohibits the state of Missouri's control over private health insurance. A similar bill is introduced in Kansas. In fact, it even allows taxpayers to sue a state worker or agency who are involved in the exchange process that's not required by federal law. Senator Schaaf's office never returned our requests for interview. But what about the care you received? 10 years ago, Heartland Regional Medical Center anticipated changes to quality care compensation, so they began a focus of expanding outpatient care services, because part of the act focuses on keeping people healthy and minimizing major elective procedures. Chief Strategy Officer Dirk Clark.
So it kind of fits in with that same mindset of care closer to the home and what care can be provided outside the hospital. Hospital is a very expensive place to be.
Another provision of the act, accountable care organizations.
As a patient in the hospital, when the nurse comes in to you, they're going to check your wrist and see a barcode on your wristband. Every time something is done, every time you receive medication, they'll barcode to make sure that this is the right medication with the right patient as a way to improve quality.
Clark suggests looking to the Mayo Clinic as a model for future care at hospitals. Doctors there have access to a major database with evidence-based medical treatment. They collaborate with other doctors using that database of symptoms and treatments to better care for a patient. But 7 months after the law was upheld by the Supreme Court, a lot still has to be determined, including how much and when this will cost you. The Congressional Budget Office released a report this week. It anticipates nationwide exchanges to be delayed because they won't be ready to offer new options. The ability of state Medicare programs to absorb new beneficiaries is still questionable, and people's responses to the availability of the new coverage is uncertain. It projects that only 7 million people will enroll in these exchanges in 2014, compared to the 9 million forecasted last year. It also claims the Medicare projections are too low, and if paying for the override is not offset with other Medicare spending cuts, it will increase Medicare's costs even further. For hospitals like Heartland, whose doctors don't receive much funding from Medicaid at all right now, that uncertainty is difficult to plan for.
Some cuts we thought were going to come into place January 1 have now been put off till the end of February, and we'll find out then whether they get put in then or delayed again. Another one is the physician fee schedule for Medicare. Remember that Heartland is both a physician group and a hospital. We have got to find as a country a way to pay physicians for Medicare. every year we have this giant fight.
Now, more changes will be coming in 2014, but Missouri Republican lawmakers have already expressed opposition to a Medicaid expansion. Governor Jay Nixon's administration estimates that nearly 260,000 additional people could join the Medicaid rolls in fiscal year 2014 if eligibility for low-income adults expands to the levels allowed under the federal law. Greg Miller, Fox 26, KNPN.